utmost pride, confer upon Dr. Mohan Joshi the Distinguished Doctor Award on the auspicious occasion of the Doctor's Day observed on 1st July 2022. Respected Dr. Mohan Joshi, sir, your journey of imbibing education started from Mumbai. Thereafter, you joined Tilak College, Tilak, which gave you a platform to enter into the field of medical education. Sir, you acquired your MBBS and postgraduate qualification from the prestigious Lokmanya Tilak Municipal Medical College, Mumbai. Sir, you have passed Masters in General Surgery with laurels in 1987. Sir, you also have your credit FCPS, MNAMS and FAIS. Sir, you are a renowned surgical gastroenterologist and endoscopist. Sir, currently you are the Dean in charge of Lokmanya Tilak Municipal Medical College and Hospital, your alma-mater. Sir, you joined your alma-mater as faculty in the year 1988. Sir, your academic and professional skill was very well appreciated and recognized by the leading faculty, which enabled you to become the head of department of the general surgery. Sir, you have received advanced training in therapeutic endoscopy from numerous stalwarts of India. Sir, you have also received training from international endoscopists. Sir, you have learned the art of surgery of pancreas and liver from Professor Akimasa Nakao, Nagoya, Japan. Sir, you have perfected advanced therapeutic endoscopic surgery from Prince of Wales Hospital and from Professor Dr. Sidney Chang of Chinese University of Hong Kong. Sir, you have learned endoscopic treatment of gastrointestinal mucosal cancer by SMR from Professor Dr. Shim of Soon Chang Hong Kong University School of Medicine, Seoul. Sir, you have held several prestigious positions in municipal medical colleges of Mumbai, including Dean of Topiwala National Medical College and VYL Nair Charitable Hospital, Mumbai. Sir, for your untiring efforts and advocacy with government machinery, 4 new departments, namely nephrology, neurology, transfusion medicine, and surgical gastroenterology were added to the Lokmanya Tilak Municipal Medical College and Hospital, a renowned tertiary care hospital. Sir, you are famous for holistic development of all departments and institutes for common public. Sir, your exemplary services during COVID-19 pandemic was known to all concerned. Sir, you established first quarantine center for Mumbai, which was later converted into a full-fledged dedicated COVID hospital by the name Seven Hills Hospital, Andheri, Mumbai. Sir, you have hit a century of publications in prestigious index national and international journals. Sir, you have contributed several chapters of relevance in internationally renowned medical books. Sir, you are a researcher of a very high reputation. Sir, you have developed innovative techniques of the HACCP operation, which is now aptly famous all over the world as MAJ modification. Sir, your enthusiasm and interest in social activities is evident from the fact that you were only General Secretary of Students Association of Lokmanya Tilak Medical College, Mumbai during your undergraduate days in the college. Sir, you are epitome of time management. Sir, in spite of the busy occupation, you have been serving the rural and Adivasi population since many decades. Sir, you have served many associations in highest capacity. Sir, you are honorary faculty of the College of Physicians and Surgeons, Mumbai. Sir, you are fellow of College of Physicians and Surgeons Examiner, and also have performed the most important duty of Medical Council of India Inspector. Sir, you were Honorary Secretary of Bombay Gastroenterological Research Society and Executive Committee Member of Gastrointestinal Endoscopy of India. Sir, you are on the editorial board of Hepatogastroenterology and the Indian Practitioner Journals. Sir, you are the recipient of the Wilson Cook Award the International Young Investigator Award, and the prestigious Shushrat Award. Sir, you are blessed with a son, Dr. Ashwin Joshi, an orthopedician, a daughter, Dr. Aditi Joshi, an ophthalmologist, and a caring wife, Mrs. Josna Joshi. Sir, on the auspicious occasion of Doctors' Day, the Indian Medical Association wishes you a very fruitful, committed life, bouncing health, and success all the future. God bless you. Thank you.
I will start from audience. Good afternoon. The senior teacher and ex-dean of LTM Medical College, Dr. Mrs. Madhuri Kulkarni. My another teacher who is also sitting in audience, Mrs. Shanbag, who was a teacher of community medicine. General Secretary of IMA, Dr. Lad. The program chairman, Dr. Hosi Kapadia, who is also a Tilakite. My friend Dr. Mokal, the president of IMC, NMC, Dr. Utture, Vice President of IMA, Dr. Anil Pachlekar, who is also Tilakite, Utture is also Tilakite from Science. President of the award, Dr. Parekh, and other people on the dais. In fact, to tell you that June, July and August have played a great role in my life. These 3 months. Way back when I was in 3rd standard, my father was a general practitioner in Mumbai, and there was no concept of keeping the dispensary closed. On 20th June 1968, I used to have school in the morning at 7 o'clock and then would return by 12:31 and would go to my father's dispensary, meet him and then go for food. That was the program. And I saw my father's clinic closed in Mumbai. That was something which was, unusual for me, because never my father's clinic was closed. Ordinarily, he would be working. And then he was, that time, he was about 50, at the age of 50, and he had developed a transient ischemic attack. And he was lying down at home, and one of his own students who had started practice and who was a dermatologist had come to see him. They were taking his BP and all that. And since then, his activities gradually diminished, and eventually he developed supranuclear palsy and a variant of Parkinson's disease. Now this resulted, I was the only child in the family, and this resulted in tremendous financial problem. He would practice, but very limited practice. And then I was always looking for someone who would help me in my further education from that day onwards. And when I came in 8th, I thought that it's very difficult for me financially to go ahead with education. So in fact, I had decided that if I pass 10th, I would take up a government job or do what is called as Bhikshuki in Mumbai, learn little astrology, but still I was not comfortable with that idea. My father was not comfortable with that idea. And he said that we will see how you can get help for. And then there was a person to whom I used to come for getting financial help, and his name was G.D. Gokhale. He was the owner of Kasav Chap Machar Agarwati, and they were very big business that time. And I came to his place one day when I was in 8th standard. That was in 1974. And he said, Mohan, I may not be able to help you all alone. You go to various places, and one of the place is Mahalakshmi Temple Charities. You go from here to Mahalakshmi, and then of course that I did not dodge so much that how to go and all that. And I thought that Mahalakshmi Temple must be near Mahalakshmi station. And I started walking on this road from Mahalakshmi station. Where is Mahalakshmi Temple? Where is Mahalakshmi Temple? Where is Mahalakshmi Temple? And I eventually, after walking a long distance, which appeared very long to me, because in a small rural place, everything is just across and apart. And I traveled in 1974 for getting some help and scholarship from Mahalakshmi Temple Charities. I reached Mahalakshmi and prayed, and then went to, on the back side there was an office, and I applied, and I used to get some, sort of medical help, not medical help, educational grant from Mahalakshmi Temple Charities. And I never knew that the road on which I walked in 1974, in 2022, I would be felicited in the very same. Of course, that then I stood first in Mumbai, I stood first in Thane district. That time there was no need, and I was accommodated in medical college. I was getting in any medical college admission. 4 deans used to sit, and they would say that which college you want. I said that I will take up that college which will give me hostel, because I can't travel daily from Mumbai. That was my problem and condition. And then Dr. Panse, who was the professor of community medicine and was the dean of Indian Medical College, said, come on, I'll give you hostel. I promise hostel, come on. So that is how I came to Sion, and eventually Sion was also very near to Kalyan as compared to Parel and JJ and Nair. So that is how I became a Sionite, Tilakite, and I remained in Sion. During my undergraduate studentship, I did a lot of work, social work. I used to be hostel secretary, I used to be cultural and general secretary, and Pashnekar used to be my friend. I remember that Pashnekar was parasiting my house, and I used to eat in my hostel room, and because his mother was working and he was staying in a quarter of Sion Hospital, and I used to eat many months tiffin from Dr. Pashnekar's house. Thereafter, I was so much attracted for becoming an MD. But somehow, despite of scoring high rank in theory of medicine, I scored less in practical, and I was pushed on surgery side, and then I became surgeon. Dr. Lad was my registrar and I was house officer. We were trained. Dr. Utture was a senior person in the department of surgery. We were trained very rigorously. That training, I just can't imagine what is going on now and what was there. Dr. Utture will definitely perceive it, and Dr. Lad will perceive it. Our teachers were very tough, but we were trained very meticulously, and that has helped us. Dr. Acharya, Dr. S.P. Nadkarni, Dr. S.P. Nadkarni helped us so much. They were very strict. Houseman's pulse used to go by 10 beats, and registrar's pulse used to go by 20 beats, if Dr. Lad will agree with me, when the rounds would start. So that kind of work we had to undergo, very religious training. And thereafter, I liked the teaching profession so much, and I opted to become assistant professor. In the beginning, I was offered a post of CMO. I was there as a CMO for some days, and later on I was pushed as a lecturer. And then I continued to do some post, that is CMO's post and lecturer's post, for almost 4 months together, both. That is almost working more than 16-18 hours. But that made me a lot of tough person. And then after passing my MS, I became assistant professor, and I developed interest in endoscopy. The reason was that the Department of Surgery had developed an endoscopy unit then, and Dr. Mrs. Deshmukh, who was then dean, told me to develop an ultra-modern endoscopy unit, and she practically helped me for everything, for sending me abroad, for sending me to Madras, giving all the equipment, and I religiously go on working, and endoscopy remained my passion. And we developed the best of endoscopy techniques, we developed best of endoscopy research, we developed the best of endoscopy equipments in the state of Maharashtra, in Department of Surgery. And Dr. Utture and Dr. Lad, who know these things about Department of Surgery, they will agree with me that we still have the highest number of therapeutic endoscopy procedures going on inside. In fact, recently I spoke as endoscopist ODC, an oration which is very prestigious in the Maharashtra chapter of Association of Surgeons of India, conference which was held in Pune in last 3 months ago. So endoscopy remained my passion, and then I became professor and head. We trained almost more than 100 students who came under my postgraduate training. We trained more than 250 surgeons, especially for advanced endoscopic work, from all over the country who are not science students. And then I became head of the Department of Surgery in 2016 when Dr. Satoskar was transferred, my contemporary colleague, to KM Hospital. And then in 2019, the post of dean came up, and I was into practice because from 2006 we were allowed private practice officially, and I used to go to Nanded. We had set up an endoscopy center in Nanded. We had set up an endoscopy center, advanced endoscopy center in Dhula. So I used to go at very many places, traveling late night and coming back again, and sometimes almost, you can say 96 hours of continuous working in a week sometimes. So that kind of work, looking after unit, looking after Sion Hospital, the departmentship, etc., head of the departmentship. Then everybody requested that you have a lot of love for Sion Hospital, you have been a native of Sion Hospital. Sion Hospital needs you, and now you give up your practice. I was in my peak of practice. I was also professor and head and was enjoying a lot of research, training students, teaching students, doing department administration. But a lot of people, including Dr. Lad, who had come to convince me that I must take up the post of dean. And not only that, that somebody said that the post of the dean is somebody. There are 4 medical colleges, government medical colleges in the city of Mumbai. There are 6 posts of member of parliament. So you are even higher than the post of Member of Parliament in Assam. And this argument convinced me, and then I had a lot of love and affection for the San Hospital. And I became Dean in August, so June, July, August is always an important month for me in my life. I became, August 19 I became the Dean, and then that time before becoming Dean, because I was not ready to take up the post of Dean, because whether it is really worth it, because I was into practice and there was not much of monetary increment, and I had to give up my practice. So the Commissioner of Mumbai, Mr. Pardeshi, he called me. He said, what is this? You are not taking up Dean's post? I said, I am in practice, and you can't permit me to do practice as well as post of Dean, hold the post of Dean. He said, Dr. Mohan Joshi, I am giving you post of Dean. You are the senior most, and I have heard a lot about you. Forget about practice. What practice? Take up this post and go away. And he literally forced me that you should become Dean, and that is how I accepted the post of Dean and worked for San Hospital, which is to the nearest to my heart after my family members. We started 3 new departments, that is neurology, nephrology, and surgical gastroenterology. Though I am not the faculty member in surgical gastroenterology, we have started that. Then I took, because what I felt that remaining Dean only and not doing something for the other health system, it doesn't fall into my purview, but still do an attempt. And then I found that large number of peripheral hospitals had a great potential. They had modular operation theatres. Every corporator is demanding good laparoscopy set, good CT scan in the peripheral hospital. And the things were underutilized. We started Balasaheb Thackeray Hospital and about 12 modular OTs there. We did not know what is modular OT, we had to go and see there. And not even 12 operations in a span of a month. And then when I discussed with the teachers and honorary teachers there, they said that how can we operate a supra-major thing, though we wish to, when there are no resident doctors. So then, in the time of Dr. Mrs. Ashwini Joshi, who was the additional commissioner, we first immediately got attachment of FCPS, that is Fellow of College of Physicians and Surgeons, postgraduate post, and then we identified 6 peripheral hospitals in which we started DNB courses in medicine, surgery, gynecology, pathology, radiology, anesthesiology, the basic subjects. And mind you, we aimed at 86 posts. We got 69 posts by now. Some inspections are going on. And I am sure we appointed 182 consultants, full-time. They were allowed private practice. And Mr. Pardeshi then and Mr. Chahal now supported me. We appointed 186 people on a full-time salary, which is nearer equivalent to professor's salary. And we appointed them on a contractual basis. The things have started working so well. When the full-time teachers came there, they are allowed private practice. But the thing changed, that a place where there were no 12 surgeries in a month, that has gone to 150 and 180 only orthopedic surgeries in PDPA hospital, where my son is actually the senior registrar. So the things have improved. NICUs have been started, MICUs have been started, PICUs have been started, and therefore now they are able to do complicated deliveries. And the delivery rate, which used to be 65 and 55 per day in my own hospital, has gone down to 25 to 35. That is the beauty that people could take advantage. This is what I am trying to do. And when I did that, and when I started doing that, I was warned during COVID pandemic at middle of the night. Order came from Commissioner that go to Seven Hills Hospital. Seven Hills Hospital was absolutely a bhoot bangla. In a month's time, we started there. More than 100 ordinary oxygenated beds and about 300 beds and 30 dialysis machines. Because that was a concern. I have seen the lions and the kings and the big corporators of the municipal corporation and big leaders of the party carrying a patient in ambulance along with driver, and just because he is COVID positive, he is not allowed dialysis in a private dialysis setup. Everybody pull their shutters down. We started doing there more than 100 dialysis in a day. After the work was getting over from Seven Hills, I was summarily transferred to Nair Hospital because the mortality from COVID was very, very high. And unless the medical teachers are roped in, corporate hospital, the expenditure was beyond the common man's, ICU care was beyond the common man's purview or, in the financial budget. Mr. Pardeshi transferred me to Nair Hospital to convert that as a dedicated COVID hospital, which was the need which was opposed by everyone, that medical college. But the Nair Hospital became the first COVID hospital of the country and treated maximum number of patients. I will tell you a touchy incident that when I was in Nair, a lady who was from elite class, that means that Mercedes and BMWs were at her disposal. The lady delivered at 1 p.m. in the afternoon. And at 4 p.m. the report came that she was in an elite hospital of Bandra. The report came that she is COVID positive. Within few minutes, all the relatives disappeared. Within an hour, that lady was pushed in 108 ambulance. And she went on hunting a bed for her in a postpartum state after cesarean section, wandering 8 hospitals and coming near Nair at 2 a.m. in the morning. And the driver was fed up. He said that I am dropping you here. This is a COVID hospital. You go in, cry, and get admitted. And they told me that there is a lady with few hours child. And we started in Nair, which was a dedicated COVID hospital and medical college, a Nair maternity for COVID. Delivered more than 1,000 till I was there. COVID women who were safely delivered, all children were negative and almost nearer 0% mortality. All the people safely. This is what is the work which we have done during our tenure for poor people and rich people, and so-called as touchy medical work. I am really proud. I have been associated with IMA. I am a member of IMA. But on this Doctor's Day occasion, IMA Mumbai has felicited me. I owe them a lot. I promise here, for any of the activities of IMA in future, educational or in healthcare, I'll be at their disposal. Thank you so much.